Okay, let's get started. I just want to say good morning to everyone and thank you for joining us for our webinar. This will be recorded. My name is Shakita. I'm the brand manager here for Network Insurance. And today we have JC Moreno, the National Director for ACA here with us to go over some ACA basics and why you should be selling ACA insurance. Without further ado, please join us in welcoming JC. Good morning,
Well,
JC.
good morning. Good morning, everyone. Thanks for the opportunity here to join you guys. You guys can see my screen.
Yes, we can.
Perfect. All right. Well, you know what? Let's get started. I think my goal here is to, help maximize your knowledge on ACA. There may be many of you coming from with different experiences. Some of you may be coming on board and on this meeting and you're trying to gain more knowledge on ACA. Some you may have some ACA knowledge already. Um, some of you may be thinking about jumping into ACA. Some may be skeptical about joining ACA. And I think all those are very valid. And I hope that at the end of this presentation, that I can encourage you to add ACA to your portfolio, considering it's definitely a great time to get into ACA. For those that are familiar with ACA and in the ACA space, um, there may be some changes for 2026. However, I don't think there's anything to really worry about. ACA is not going anywhere. I think that a lot of the changes and a lot of the proposed changes and a lot of the changes that have already occurred are a result of um, an industry that just needed a little bit more stability. And I think that a lot of the rules and regulations that have been implemented have all helped stabilize the market. So with that said, let's get started. So here's our agenda. We'll talk. I want to talk a little bit about understanding the ACA marketplace, ACA, a little bit about ACA product knowledge, compliance and regulation, and then some technology and tools. So we'll start with, where ACA, a little history on ACA, how it started, and kind of where we are right now. So back in 2011 is when ACA began. There was a period and a season where many carriers exited the market because there weren't commissions. Commissions weren't being paid. 2014, you start seeing carriers jumping back into the market. And as you can see on the graph on the left, ACA enrollment, at the present time, we're at almost 22 million consumers or members on ACA. We see that jump happening from 2022 and up. On the far right, you kind of see the graph, as well as, kind of where we are for 2025, right? So this last open enrollment, we hit historic numbers, hit record numbers, and that's kind of where we're at right now. And then on the right, you'll see some additional data showing new consumers in the blue, and then the gray is going to show returning consumers, and then purple is where we are, the total amount of consumers that have been enrolled. So you could see that we're in an upward trend with ACA. And this last open enrollment was impacted by some of the regulation changes, but we still saw an increase in the amount of apps that were submitted for this last open enrollment. So the Affordable Care Act, the American Rescue Plan of 2021 really is what boosted, right, a lot of the production and a lot of the awareness around ACA. There was more funding, there was more contribution and subsidies that would help cover a lot of the premium, and the benefits increased. So we see the enhanced premium tax credits that were set. They were set to expire in 2022. But when the Inflation Reduction Act was signed, it extended the ACA subsidies through the end of this year, right? So at the present moment, it is scheduled or expected to expire at the end of this year. That's what most people are expecting. However, I think there is still a possibility that it could be extended past 2025 based off of my sources. But there's also a possibility that they will expire. If they do expire, then uh, the market's just going to shift back to how it was in 2019 and 2020. In 2019 and 2020, more consumers were enrolling into bronze plans in order to keep their premiums significantly low, but they were taking on more risk, right? And having higher deductibles and higher out of pockets. So this last open enrollment, 4 out of 5 individuals who applied for ACA qualified for $10 or less. So you're talking about a significant amount of the market that's paying $10 or less in premium due to subsidies and enhanced subsidies. The only difference between the market right now and the market in 2019, 2020 is that right now consumers can enroll into a silver plan, with much better benefits at $10 or less. If the enhanced subsidies expire at the end of the year, then it's going to look like more consumers buying bronze plans, which is they're going to take on a little bit more risk on the benefits, but then their premiums, they're able to still keep their premiums under that $10. Now, once upon a time, ACA commissions were a contentious topic, right? With many carriers cutting payments, and that's where I mentioned earlier, where we saw a lot of carriers just exit the market. However, that's no longer the case, right? ACA commissions are typically paid per member per month. So now there's a percent, and then there's a percentage payment in some cases. Man, this creates a golden opportunity, right, for agents to make a steady monthly income, which adds up very, very quickly. So here, I'll give you guys an example. So the average PMPM, which is per member per month. So if you submit an application with 4 people on it, a family of 4, then it's $25 times 4, right? So it's PMPM per member per month. So it doesn't matter if it's an individual case. I mean, if it's 1 application or 2 applications, it what depends on how many people are going to be insured within the application. So it's a PMPM average of $25. If you look at this graph, I mean, just adding 10 members a month, I think that many of you, just through your social media, can probably touch 10 people in a month, if not more, right? And likely find a large percentage of them uninsured or in a really bad situation for healthcare. Under 65 market, in my opinion, is the largest market out there, and it's the gateway to all products, right? Life insurance, MA, Medicare, annuities, right? All, the under 65 is the gateway for all products, and ACA is a really good kind of bait, right, to reel people in, because it's a product where there's great benefits, and the government is providing tons of funds for people up to 600% of the federal poverty level. So if you have a consumer if you enroll 10 people in month 1, you're already going to be building a residual block of $250 a month, right? $250 a month are going to be coming in every single month, right? For 10 members. Now, let's say next month you add another 10 members on top of the 10 that you enrolled this month. Then now you've increased your residuals to $500. Now, month 3, month 4, so on and so forth, adding just 10 members a month, right? Maybe doing your own marketing, maybe buying some leads, maybe putting out some flyers, right? However it is that you're going to market, or maybe you already have a book of business, right? Of life insurance book of business, or someone that sells life insurance, right? That you can help cross sell and help bring business in. You don't always have to buy leads. You can always go out and find your own leads. Why? Because again, the under 65 market is a large market. You could stand in front of a Walmart, right? Or Target, or any store, and you'll probably run into 10 people every single month that's looking for healthcare or finding a better solution. So by the end of the year, in just 1 year of adding 10 members a month, you've already built a residual block of $3,000 a month, right? I think that's pretty significant, and the efforts that you put in are worth it. Now, we're not even talking about cross sales. We're not even talking about dental or accident or critical illness, right? You can always cross sell on an ACA plan, especially if a consumer qualifies for $10 or less in premium. They could probably pay another 10 or 15 bucks and get a good dental plan, critical illness, or an accident, all right? Or even an indemnity plan, in the event that they're out of pocket or the deductible is significantly higher, right? To help bridge that gap. So here are all the carriers that we currently work with. Um, we currently have available all of these carriers, and here's the coverage map to show you where we're able to sell, where ACA products are available, right? And a lot of household names, right? A lot of carriers that are in the Medicare market, that are in the life insurance market, right? So, so we're talking about very good carriers, that are all, available, for you to contract with. So how do you get started with ACA? Well, you got to have a 215 license or a 240. You got to be FFM certified. You can do your FFM certification either through Health Sherpa or healthcare.gov, and it's completely free, right? You don't have to pay for your FFM certification. First timers, if it's your first time taking it, it'll take you a few hours to get it done, to complete. However, if you're renewing your FFM, it's only a fraction of the time. It should only take you about 20 or 30 minutes each year to continue to renew your FFM certification. You got to contract with the carriers that are available in your state. So if you're licensed in, 3 states, then just make sure that you're choosing carriers that are available in those 3 states, right? So then the more carriers you have in those 3 states, the more options you're going to have for your consumers and the better option you'll be able to provide them. After that, you're going to create a Health Sherpa account. Health Sherpa is the quote and enrollment platform that most agents use in order to enroll consumers in the ACA. You could use healthcare.gov. You can use there's other platforms out there as well where you can do enrollments for ACA. However, Health Sherpa has over 55% of all ACA enrollments in our country are done through the Health Sherpa platform. I'm biased because I've used Health Sherpa before through when I opened an agency. The reporting is great. You got dashboards on there. It provides you with reminders on how to help you manage your book of business, right? If there's consumers that are requiring payment, if there's consumers that require additional documentation, Health Sherpa provides a really easy way to help manage the business and help upload any documents that you need to upload, or even pull any data or pull your information on your book of business. Cool. And then once you're approved, you start. Once you've checked off all these boxes, then you're ready to sell ACA. Very easy. Now, understanding the ACA marketplace. So we talked a little bit about the history. This is a little bit more history. I don't want to dive too much into it because it could take me, I don't want to read through it. However, if you want to go ahead and take a screenshot, you absolutely can. But what it's saying here is that, ACA was implemented, during Obama's presidency back in March 30th of 2010. And then January 1, 2014, there was another rule that was implemented where, every consumer, every plan that was created for ACA needed to cover essential health benefits. And there's about 10 essential health benefits that we're going to go through that are required to be covered on the ACA. The 3 primary goals for ACA was to make affordable health insurance available to more people, expand the Medicaid program, and support innovative medical care delivery methods. More Americans are eligible for coverage. So the American Rescue Plan, as I mentioned before in 2021, is what helped provide a boost in the ACA market and provide additional funding and more funding for for consumers to help lower their premium and increase their benefits. The enhanced premium tax credits were set to expire again at the end of the 2022, but the Inflation Reduction Act extended it to the end of this year. CMS reported 24 million people that selected a plan year that selected a plan this past open enrollment. There were 3.9 million new consumers, which was more than the prior year. So we saw 16% year over year growth. That's more than double than the current MA market growth rate. 4 out of 5 individuals, again, who applied for ACA qualified for $10 or less in monthly premium. Now, understanding the marketplace. So there's the individual mandate. Initially, the ACA required most Americans to have health insurance or pay a penalty. This mandate helped nullify that. So if you don't have coverage, you're not going to get penalized for not having coverage. Health insurance marketplaces, the ACA established online exchanges where individuals can compare and purchase insurance plans. Medicaid expansion, that also kind of provided a boost for ACA, believe it or not. So a lot of states, what they did was they extended the Medicaid expansion means that they took their federal poverty level and they increased it by 138%, right? So instead of the federal poverty level, right now it's set at about 15,200 or 600. I can't remember the exact number, but I think it's around 15,500. And it increased it 138% to about 20,000, 21,000 that you can make. So if you're earning $21,000, then you qualify for ACA. But then there's also the Medicaid expansion helped bridge the gap of those consumers that weren't broke enough to get Medicaid and were making too much money to be able to afford, right, or get some type of subsidy. So the Medicaid expansion helped close that gap. Essential health benefits. So the law requires all insurance plans to cover a set of essential health benefits, which we're going to go through here in just a moment. Pre-existing conditions, right? It doesn't matter what condition you have, you can enroll into ACA, right? A consumer can enroll into ACA. So you can have cancer. And as long as you have an SEP or you're within the open enrollment period, then you can choose an ACA plan and you'll receive coverage. Young adult coverage. The ACA allows young adults to stay on their parents' insurance plans until the age of 26. So it's very similar to employer coverage, right? Or major medical. It is major medical, right? So you're talking about consumers that if you have a family, you can keep your child on the plan until the age of 26. So what's the structure of the ACA marketplace? You have the state-based exchange, right? Those are states, they are ran by individual states. Each state has the authority to manage its own marketplace, including plan certification, consumer assistance, and outreach. So the difference here between, with state-based is that it not only requires the FFM certification, but you'll also be required to complete additional training and certifications to be able to sell ACA in state-based exchanges. And we're going to see a map on which states are state-based and also which states are federally facilitated. So those are the FFM states. So you definitely have more FFM states than state-based. FFM means that, it's managed and it's ran by the federal government and CMS. So that the FFM states or CMS state-based are ran by their individual states. So different rules. And then you have the state-based exchanges on a federal platform. So it's like a hybrid model, right? These states manage certain aspects of their exchange, such as plan certification and consumer assistance, while still relying on healthcare.gov, Health Sherpa, right? Platforms that you can use that CMS has approved that have EDE technology. So in summary, the main difference lies in who administers the marketplace, whether it's the government or the state. And here's a map that shows you which states are FFM, which are ran by CMS or the federal government. You're going to see the dark blue. Those are the state-based exchange. And then you have the state-based marketplace federal platform, which means that these are the hybrid states that couldn't quite figure out what they wanted to do. So they're like sitting in between in a hybrid model. So there's 4 different types of plans. Checking my time here. Four different types of plans. You have bronze, you have silver, you have gold, you have platinum. For me, this is a really easy chart to look at and see, okay, what's the difference between bronze, silver, gold, and platinum? Well, uh, it tells you the insurance company pays out 60% in the bronze plan, and then the consumer is left with the responsibility of about 40% of the cost for their medical services. And then as you go up in category, then the insurance company pays more and more, right? So if you have a consumer that's let's say, for example, has cancer, right, or heart condition, or diabetes, or high blood pressure, right? They have a condition that requires them to regularly go to the doctor, or they're at high risk of an emergency. Well, I would highly recommend a gold plan, right, or a platinum plan. Why? Because those are uh, those are very those conditions can be very costly. So you want to choose a plan where you might pay a higher premium. You're going to get a lot more coverage, for the consumer, with the gold plan because they're sick. This is just a little bit of a breakdown for each one. I'm going to kind of go through these quickly because I think that first chart that we looked at paints a really high level picture of what bronze, silver, gold, and platinum are. So again, bronze, low premium, but high cost when you need care. Silver plans, you have moderate monthly premium, and then you have moderate costs when you need care. So it's in between. This is probably a consumer who goes to the doctor for their normal checkups, right? Eventually goes to their urgent care if they're sick, or is on a regular medication to help regulate, something. So again, silver plans are more for that. It is the most common plan that people enroll in right now. A big reason why more people enroll into silver as well is because of the cost share reduction. The cost share reduction is something that consumers can qualify for as well, that help provide better coverage for the consumer, but it can only be applied to the silver plan. So only silver plans have the opportunity to have the cost share reduction. So you get the savings on the subsidy, but then you also get better benefits. And this is a little bit about cost share reduction. Again, cost share reduction, as you're filling out the application and you enter in all your information, then at the very end of the application, it'll let you know if you qualify for the extra savings and the cost share. And if you do, the best plan to choose is a silver plan so that you can get the most amount of coverage for the least amount of money. Cool. All right. Gold. Again, gold, high monthly premium, but you're going to have low costs when you need care. And then platinum is the creme of the crop. And honestly, very small percentage of the market and chooses a platinum plan. It's not very common. It's the highest monthly premium that you could pick that's available, and you're going to get the absolute lowest amount of out of pocket that you can consider, which is about 10%. Deductibles are very low. So it's a good choice if you have someone that's sick. Then you have another plan, again, which is not very common. It's mostly more common for people under the age of 30. It's a catastrophic plan. So it still provides the essential health benefits, and it still provides all the preventative care, right? The only difference is that it's a very high out-of-pocket cost for medical emergencies, but it helps provide enough coverage so that the consumer doesn't go medically bankrupt if they have an emergency or need to go to the doctor. And they'll receive some type of coverage. But again, not very common. All right, so what's the eligibility requirements for a consumer to enroll into ACA then, if you don't need to have a pre-existing if anyone with a pre-existing condition can enroll? Well, you got to live in the US, you have to be a US citizen or national, be lawfully present, non-citizen in the US, not be incarcerated. Although if you are in jail but you haven't been charged or haven't been sentenced or indicted, you haven't received your plea yet. There we go. That's the word I'm looking for. If you're in jail but you're waiting to go to court for you to get your plea, you still qualify. You actually qualify for an SEP to enroll in the ACA. Just a little note. Not on Medicare. You can't be on Medicare. You can't be on Medicaid. You can't be on TRICARE, and you can't have employer coverage. So any of these will disqualify you from getting ACA. Now, you could have an indemnity plan, right? Which, because they don't coordinate benefits. So an indemnity plan is totally fine. Subsidized plans, what are they? So again, subsidies are provided from the federal government. Medicaid is similarly a subsidized plan as well, considering that the government pays all of the premium. But with ACA, it provides a very significant right now in this present moment. You can qualify for a significant amount of subsidy. If you're making around $22,000 a year, you qualify. Most consumers will qualify for $0 in premium. For a silver plan too, by the way. So in states that have expanded Medicaid coverage, your household income must be below 138% of the federal poverty level. In all states, your household income must be between 100% and 400% FPL to qualify for a premium tax credit. Now, if your income is at or below 150% FPL, you may qualify to enroll in or change marketplace coverage through a special enrollment period. So right now, there's an open SEP for anyone that is at or below 150% of the federal poverty level. So if that's your income, if your income is at 150% or below, then you automatically qualify to enroll in the ACA. And as you're filling out the application, it'll ask you, there's an income field. You enter in the income, and by the end, it'll tell you, if you qualify for an SEP or not, and it'll allow you to enroll into a plan. Now, if your income is above 400% FPL, you'll still qualify for savings. So because of the enhanced subsidies, the Inflation Reduction Act, it allowed for consumers within 400 to 600, up to 600% of the federal poverty level to get subsidy for to go towards their premium. Households with incomes above 400% of the FPL are eligible for subsidies through 2025. If the cost of the benchmark plan would otherwise be more than 88.5% of the household's income. And here's a chart that shows you what the federal poverty level is for 2025. And then the percentages. So if you want to take a screenshot, this is a good one to have. So again, when I mention 150%, again, if you look at that fourth column where it says 150% FPL, one individual making $22,590 will automatically qualify for an SEP and will qualify for subsidy. So I love to point out this piece here. So if you look at the very last column where it says 400%, a family of four making $124,000 a year qualifies for subsidy. Yeah, and qualify for savings. I'll tell you a quick, short little story. So I worked for a corporate organization that provided health insurance coverage. And when I left that organization to start my own agency, now I'm an entrepreneur, right? Now I have to go shop for my own health insurance for my family. So I have a family of four. I have a wife and I have two children. I have a 16-year-old daughter and a 12-year-old son. I can't go without coverage. It's a risk that I'm taking on. So I went on the ACA marketplace and I was able to get coverage. I thought my coverage, I had heard horror stories of families going on the marketplace and being quoted $2,000 a month in premium, $1,500, $1,200. Well, I'll tell you that with my income and the family, I was able to qualify and I was only paying $700 a month for me and my family for a silver plan, um, with only a $500 deductible, zero copay for doctor visits, and again, you get the slew of all preventative cares. There's over 70 free preventative care services available on ACA. And then you have the 10 essential health benefits that are covered under the ACA as well. So just a short little kind of ACA is not meant for is not just meant for broke people, right? And it's also not meant just for for just the average, but high income earners as well can qualify for subsidy tax credit and probably pay a less amount of money than they actually think, considering where the market is right now and how enhanced subsidies help reduce that premium. Let me go back. Sorry. So subsidy plans, what are they again? Is there a cap on how much I have to pay back? There is. So here are some rules that, because some people are wondering, well, what if I make more money than I actually write on the application? Well, there are some penalties, right? That and here are some of those rules for those penalties. So if you want to screenshot that, I don't want to spend too much time on this because but you can always find this information. You can screenshot it and take a look at it. But you'll run into this once you've enrolled people and tax season comes around. These are the kind of questions you'll start getting, and concerns you'll start seeing, from consumers, because consumers are required to call in and change their income level if their income is changed, right? If they're projected to make more than they entered into the application, it's best practice for them to call in and update that so that at the end of the year they don't have to pay back, right? Some of the premium tax credits that they received. All right, so go a little bit, a little bit about the ACA product knowledge. So again, we've mentioned the 10 essential health benefits a few times here during the call. So here they are. So it covers ambulatory, it covers emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services, prescription drugs, um, rehabilitative and abilitative services and devices. Always have trouble saying those. Laboratory services, preventative and wellness services and chronic disease management, and pediatric services as well, including oral and vision care for children. Coverage details. So again, it works just like major medical. It's got a deductible. It's got co-payments, out-of-pocket maximums. Network types are very similar to what we know if you've ever had employer coverage as well: HMO, PPO, EPO, POS. Then you have the prescription drug coverage tiers. You have your generic, preferred brand, non-preferred, specialty drugs. And at the end of the application, before you even choose your plan, you can see the formulary, right, on every single plan. You'll be able to see what medications fall under what tier, and you'll be able to see the cost of what the medication will cost you for each tier. You get free preventative services such as screenings, vaccinations, annual checkups, pre-existing conditions. Again, you don't, even if you have a pre-existing condition, you can enroll into ACA. You have young adult coverage, allows young adults to stay on their parents' insurance plans until the age of 26. No lifetime or annual limits. So it prohibits lifetime or annual limits on essential health benefits. Cool. All right. Well, guys, we are almost at the end. So I appreciate you guys. I hope you guys are taking some, getting some good nuggets here and learning a little bit. I know we're flying through this, and this is but I hope you guys are getting some out of it. Cool. So let's talk about the fun stuff. Yeah, who doesn't like compliance and regulations, right? But hey, look, it's very important, right? It's important to understand ACA does have a spotlight, right? And they are on the radar because there have been some bad actors that have just made a bad name for the ACA. So I want to make sure that now it is less regulated than Medicare. It's less it has it's a very easy enrollment process, and there aren't a lot of rules around it, right? So we want to make sure that, but there are some specific items that CMS requires each and every agent to do with their customers. So we'll go over those now. So number one, you got to make sure you get your license. You got to have your certification, um, FFM certification. Now, if you're doing state-based, then you want to make sure you do the certifications and trainings for them. You got to contract with the carriers, hold a state license. Privacy and security, so consumer consent. This is very important. It's probably one of the most important pieces before you even go on the marketplace, before you even start an application, before you start talking about ACA. Agents must obtain the consent of the individual or the employer or employee before assisting with enrollment or applying for advanced premium tax credit and cost share reduction. So there is a little script, right, and a little disclaimer that you have to read that'll be available, as you're accessing Health Sherpa and you're gonna start the process. And that consumer consent is very important. Data protection. Agents are required to protect the privacy and security of consumers' personal information. This includes adhering to strict data handling and storage protocols, right? If you're recording calls, you want to make sure that you keep them in store for at least 10 years, right? If not forever, right? Best thing to do is just keep it forever. But you also want to make sure that you're careful with who you're sharing your data with, right? I know that there was some issues this past year where carriers were not carriers, I'm sorry, agent lead marketing companies that were generating leads, were using lead vendors or publishers outside of the country. That could be a matter of national security, right? Because now you're talking about consumer data that's being transmitted overseas. So that was a big deal at some point, but there have been some rules and some regulations implemented to help prevent or help reduce, right, and minimize the risk of consumer information being stored or handled outside of our country. So compliance with marketplace rules. Accurate information. Agent must provide accurate and truthful information to consumers about plan options, cost, and coverage details. Don't just enroll a consumer and say, oh man, you're going to get $0, and you'll get all the information in the mail. No, make sure you go over some of the coverage details, right? Make sure you go over deductible, copay, out of pocket, the coinsurance, some details about medications. Ask what doctors, if they see any specific doctors, if there's any hospital systems that they specifically want to enroll. Health Sherpa makes it very easy to see if a doctor or a hospital is available in that carrier's network. So really easy to use and really easy to find that information. Prohibited practices. Agents cannot engage in practices such as steering consumers to specific plans for personal gain. For example, Ambetter has a $50 bonus. United Healthcare doesn't. But United Healthcare plans looks better for the consumer. It's a much better option for the consumer. Well, what this is saying is that, don't steer customers into a plan that may not benefit them just because, right? There is a personal gain, by enrolling them into a different plan. Always you have a fiduciary responsibility to make sure that you're providing the consumer with the best available option for their situation. Help on demand. Agents can participate in the Help on Demand program, which connects consumers seeking assistance with certified agents in real time. Guys, I know this is the compliance section, but I wanted to throw this in there because this is a great opportunity to get free leads. If you sign up as an agent on Health on Demand, there is a training that you have to go through CMS. But they will send you real-time leads. These are consumers that are going on healthcare.gov and asking to speak to an agent because they want to enroll into ACA. This program, I've heard stories of agents receiving 10 to 15 leads a week, right? And these close at a very high rate. You're talking about someone who's on healthcare.gov, right? Looking to enroll in ACA. So the close rates are usually pretty high. So even with getting 2 to 3 a week, think about that. Remember the chart I showed you earlier? If you enrolled 10 people a month, consumers outreach. Agents are encouraged to engage in outreach and education efforts to help consumers understand their coverage options and enrollment process. Um, Listen, I know agents that are very heavy on social media, right? You don't understand the value. It's very valuable when, as an agent, you go on social media and just share and educate people, right? On information that you think they should know, but they really don't. You'd be surprised how many people have no idea that there's coverage that they don't know what a subsidy is. They don't know what cost share reduction is. They don't know what a bronze or silver or gold plan is, or essential health benefits. Like they don't know any of that stuff, and they need you to help educate them and provide that information to them. And at the same time, you might win yourself a customer. Regulatory oversight. So, state and federal enforcement, both state and federal agencies oversee compliance with ACA regulations. States have primary enforcement authority, but the Centers for Medicare and Medicaid Services can step in if a state is not enforcing the regulation. Reporting violations. Agents must report any suspected violations of ACA regulations to the appropriate authorities. CMS resources. CMS provides a variety of resources for agents, including webinars, technical assistance videos, and help desk for support. Healthcare.gov is a great resource and the most reliable resource that you can tap into. Marketplace updates. Agents should stay informed about updates and changes to marketplace policies and procedures through CMS communications and training sessions. There's ways for you to go on healthcare.gov and sign up for news and emails to be sent from them. Cool. All right. ACA technology and tools. So, guys, we're at the end here. You know, so I just wanted to kind of share what are those tools that are available to you and that are going to be available to you, and how can we help support? Well, Health Sherpa is going to be is going to be one. I've used Health Sherpa. Health Sherpa provides training on their platform, how to use their platform as well. So definitely our approved and uh, and recommended platform to enroll consumers in the ACA. Then you have healthcare.gov, like I mentioned earlier, a great resource. They have a search engine. That search engine you could type in, man, JC mentioned something about cost share reduction. What is that? You can go to healthcare.gov, type in cost share reduction, and it'll give you a full explanation on what it is. Man, JC mentioned something about enhanced subsidies. What's the difference between a subsidy and an enhanced subsidy? Well, healthcare.gov can help explain that as well. Lots of it, lots of good resources, good information there for you. Then you have yourfmo.com. On yourfmo.com, you'll be able to find information. There's an ACA section where I've been able to put in some videos in there. I've shared some links where you can go to specific state-based training and certifications. There's a little bit of history about ACA. There's also maps that you'll find there. You'll find all the different carriers that we offer and that we have available. So definitely a lot of resources on yourfmo.com as well. And then, of course, your network insurance senior health division. So they're available as well, and they're a great support system, and have been in the industry for a very long time, and can help support you, through your journey and entry into ACA. All right, guys. Well, that is all I had. I appreciate your guys' time. Um, let's jump into some Q&A here. So any questions you guys might have?
If you have any questions, you can unmute yourself.
Yep, you could use the chat or you can unmute, however you like.
Let's see. So we do have a couple in the chat, just a couple comments. Someone said CSR helps in the silver plans. Um, Also, one of the marketers want to know if we can get a copy of this deck by any chance for the
Oh yeah,
marketers. Okay.
of course.
And then there's another comment that says there's a help on demand trading. I believe it's easy enough and can bring some clients without paying money for leads. But
100%.
unfortunately, shop isn't in Hillsborough County.
Yeah. Many other counties you can get it though.
All right, well, it doesn't say that we have any
All right.
questions, JC. So I want to thank everyone for joining this insightful webinar with him. And thank you again, JC, for all the information in this presentation you gave us for
I have a
making AC.
question.
Oh, here we go. Go ahead.
Thanks for listening. How would I get listed on the CMS to get leads from them?
So if you go on CMS and you type in help on demand, then you should see a guide there to show you how to get certified, how to get and get and do the training, so that you could start getting those leads.
Thank you so much.
Yeah, my pleasure. I
All
knew that
right.
would catch some attention.
Yeah, it's all, yeah, you got to get those leads in. So again,
Yeah.
thank you, JC, for the wonderful presentation and making the ACA a little clearer for us.
Yep,
And
no
thank you,
problem.
everyone on the call. We'll be doing this probably monthly, so we should have another call coming up with JC with more information in the next few weeks or so. And if in the meantime, if you have any questions, you're more than welcome to call the office and reach out to any of our marketers. Our phone number is 800-662-5080. And again, thank you for everybody for joining this call. Have a great afternoon.